Dentists of Reddit. What's the wildest thing you've seen in a patient's mouth? I've been a dentist for over a decade, and let me tell you, I have seen some nightmare fuel inside people's mouths. I'm talking about patients who haven't brushed in years and act surprised when I tell them their teeth are rotting. People who superglue their broken teeth back in place. Yes, really. One guy who chewed on metal for fun and wondered why his molars were shattered. But the wildest case? That one still haunts me. The man who grew a tooth garden. A middle-aged man, let's call him Jim, came in complaining of severe mouth pain. His appointment had been booked for months, but he kept canceling until one day, he couldn't take the pain anymore. The second he opened his mouth, I almost gagged. Jim's teeth were black, not just stained, rotting, crumbling, and covered in weird, fuzzy growths. At first, I thought it was just an extreme case of gum disease. But then I took a closer look and realized his mouth was growing mold. How does that even happen? I asked Jim about his hygiene routine, and he shrugged like it was no big deal. I don't brush every day, maybe once a week, and I drink a lot of soda. A lot was an understatement. Turns out, Jim had been drinking a 12-pack of soda daily for over a decade, with no brushing, ever. The sugar buildup had turned his mouth into a perfect breeding ground for bacteria and mold. Yes, mold. I had never seen anything like it. The aftermath. Jim ended up needing almost every tooth pulled. His gums were so infected that we had to treat him with multiple rounds of antibiotics before we could even think about fitting him for dentures. And the worst part? He still didn't think it was a big deal. His exact words. I mean, they weren't hurting that bad until last week. Sir, your mouth was growing a science experiment. Moral of the story? Brush your teeth. Because if you don't, you might just end up harboring a fungal ecosystem in your mouth. Story 2. Doctors of Reddit. What's the weirdest case you've ever had? I've worked in the ER for over a decade, and trust me, I have seen some things. A guy who came in with a full fork stuck in his throat because he wanted to see if he could swallow it. A woman who claimed she was pregnant with twins. She wasn't even pregnant. A man who casually walked in with a knife lodged in his leg and said, I figured I'd finish my shift first, but my weirdest case? Oh, buckle up. The case of the coughing man. A middle-aged guy, let's call him Bob, came into the ER complaining of a bad cough that wouldn't go away. He was completely healthy otherwise. No fever, no shortness of breath, no infections. Just a deep, rattling cough that had lasted for weeks. We did an X-ray to check for pneumonia or something stuck in his lungs. What we found, there was a tiny, fully sprouted plant growing inside his lung. How did that happen? Turns out, Bob loved eating sunflower seeds, but he also had a bad habit of inhaling while he ate. At some point, he must have accidentally inhaled a seed, and instead of coughing it out, it somehow got lodged in his lung. And since the lungs are warm and moist, the seed actually started to sprout. Bob had a literal tiny plant growing inside of him. The aftermath. We had to surgically remove the sprout, and Bob was fine after that. He was shocked but also kinda proud. He even asked if he could keep it. No, Bob, you cannot take your lung plant home. To this day, I still think about that case. Because you always hear parents say, don't swallow seeds, or they'll grow inside you. And, well, turns out, sometimes they're right. Story 3. Doctors of Reddit. When did your gut feelings save a patient? Doctors rely on science, tests, and symptoms to diagnose patients. But sometimes, gut instinct can be the difference between life and death. I'll never forget one night in the ER when my gut feeling saved a man's life. The man who just had heartburn. It was a busy Saturday night in the ER, full of drunks, minor injuries, and the usual chaos. Then an older man in his 50s walked in with his wife. He looked pale, slightly sweaty, and complained of mild chest pain. I asked him what was wrong, and he shrugged. It's just heartburn. Happens sometimes after I eat spicy food. His wife nodded. Yeah, he's had this before. We only came in because it wouldn't go away this time. They were so calm about it that every instinct was telling me, it's probably nothing. But something felt off. The gut feeling kicks in. His vitals were normal. His EKG? Also normal. Everything pointed to simple acid reflux. A lot of doctors might have sent him home with antacids and called it a day. But something in my gut was screaming, no, something's wrong. I ordered a blood test for cardiac enzymes. An hour later, the results came back. He was having a heart attack. The silent killer. The man was rushed into emergency surgery, where they found a major artery was 95% blocked. The surgeon later told me, if he had gone home that night, he wouldn't have woken up the next morning. His harmless heartburn was actually a silent heart attack, the kind that doesn't cause extreme chest pain but is still deadly. After surgery, his wife was shaking. She kept saying, "We were about to go home. We almost didn't come in." That moment stuck with me forever. Moral of the story? 1. Trust your gut. If something feels off, even if the tests say otherwise, dig deeper. 2. Heart attacks don't always feel like heart attacks. Sometimes they just feel like heartburn, jaw pain, back pain, or nausea. 3. If your gut tells you to go to the ER, go. You'd rather be safe than dead. That man walked out of the hospital a week later because of a gut feeling.